Hi, Dr. Mark Richmond from Obsidian Men's Health. What should a man do when his oral ED drugs are no longer effective? That's a question that we get asked a lot, not only by patients but also by other physicians. So the situation is we have a male patient with erectile dysfunction or ED who's being treated with an oral ED drug such as Viagra, Cialis, Levitra, or Stendra. The drug was working well, it's no longer as effective, or it's not effective at all. What is the problem? What should be done? What's the next step that that patient or clinician should take? It's a great question. First of all, I approach this problem in the same way that I approach the new patient with erectile dysfunction. I want answers. I want to know why a patient is experiencing erectile dysfunction. What are the risk factors? Are there any medications the patient is using? Are there underlying medical issues at play that we need to modify or treat in order to promote better sexual function? The same holds true for someone who is no longer seeing a good result from their oral ED drug. I want to know why. Is there a progression of their disease state? Are there new medical problems at play that need to be addressed? For example, testosterone deficiency may have developed in a patient, and these drugs depend on adequate testosterone levels to be effective. So they may be working wonderfully for a patient when they're initially prescribed, and then a couple years later they stop working as well. It could be because of testosterone deficiency. Certainly other medical conditions are a possibility as well. We also want to inquire about other risk factors. Has the patient taken up smoking? Has the patient developed any new habits that could adversely affect their sexual function? We also want to look at their medications. Perhaps another physician who's caring for the individual has prescribed a drug that can have a detrimental effect on their erections. Or perhaps that new drug is affecting the ability of the oral ED drug to exert its effect. So the bottom line is, if you, as a patient, if you're using an oral ED drug and they are becoming less effective or they're no longer effective for you, you should seek the care of an expert in men's sexual health. Men do not build up a tolerance to oral ED drugs. There is no tolerance effect at play here. So it needs to be addressed from an investigative medical standpoint.